Thank everyone for coming out this afternoon in this beautiful warm weather in the hot Atlanta for sure today. And what I want to do is make sure the population at large and you in particular know some very vital information that can save y'all years and add life to your years and years to your lives. What we're doing is a series of lectures on heart and artery disease. We'll be offering lectures on many different subjects, from diabetes, liver disease, all these types of things, and obesity, that type of thing, bowel cleansing. All those things are coming up, so look in the computers and the handouts for it. My name is Dr. William Richardson, and I have started the American Clinics for Preventive Medicine. And of course, we're very much interested in preventing illness and also treating it. Now, I look at it from a preventive aspect. You can have primary prevention, which is in our children, especially preventing them from getting any type of particular problem. Then there's secondary prevention, which means, you know, you go to health fairs and you look for high cholesterol, you look for high blood pressure, and then you treat it before you get a secondary disease like heart disease or stroke or kidney disease. Then there's tertiary prevention, which is, let's say you have had a heart attack, or you have kidney disease, or you have had a stroke, cerebrovascular disease. Then we work on you to prevent further occurrence, and we work for reversal. So of course, we're going to have a theme here: heart disease is reversible and treatable. Specifically, we're talking about coronary artery disease, which is the most by far common heart disease here in the U.S. And that, of course, is where the hardening of the arteries occurs in the arteries that feed the heart the nutrition and oxygen it requires to function every day, day in and day out for your whole life. And some of the statistics are really, really alarming in heart disease in general. About 80 to 90,000 people are affected in the United States. About 73,000 people have high blood pressure. And most people who have high blood pressure do not know they have it. Most people who know they have it are not being treated. And most people who are being treated are not being treated adequately. So that's pretty bad. So, and if I said 1,000, I meant 73 million people, 73 million people have high blood pressure. 16 million people that we know of have coronary heart disease. And I'll prove to you that that's dead wrong. In fact, I'll show you in a minute how 85% of Americans in their 50s have coronary heart disease and don't know it. 85%. And that article you have is going to show you that. But specifically, almost 9 million people get a heart attack, and about 9 million more just get that chest pain, and it doesn't quite go over to a heart attack. About 6 million people get a stroke every year. And heart failure, that's when the heart can't pump the fluid out of itself well enough and it backs up into the lungs, and you have water on the lungs, and you go to the hospital, get a shot of Lasix, and you urinate a lot, and then you get relief. That's heart failure. That's left-sided heart failure. And that's about 5.5 million people per year. So that's a lot of people we're talking about here, and we all can be affected. The article that I gave you is a very eye-opening article, and as an introduction, I want to go over this article just to let you know what's really going on. And when you understand this article, you're going to understand more than a lot of medical doctors do. So pay attention. Yeah. Okay, now you know how when people get a let's say a heart attack, or they have very severe pain and you suspect they have heart disease, they may go to a bigger hospital, because I work in emergency rooms and we can send them to bigger hospitals, and they get an angiogram. Angio means vessel, and gram means you can come and have a seat, it's no problem. Gram means to visualize it. Okay, so angiogram is visualization of the vessel. And the way it's done, a catheter is inserted into the femoral artery, and you shoot dye backwards into the heart. Okay? This talks about is that conventional angiography fails to visualize 95 to 99% of atherosclerotic plaque. Athero means of the artery, sclero means hard. So hardness of the artery, plaque. This is a doctor of clinical cardiology, Dr. Stephen Nissen, N-I-S-S-E-N, and he was giving a talk at the American Association of Clinical Endocrinologists. The endocrine system is the glandular system, so these were doctors who study the glands, and he was giving a talk there. And it was shocking when I saw this, because I always thought this, and now it's on paper. 95 to 99% of hardening of the arteries is missed by heart specialists. Massive atheromas, which are streaks of fatty infiltrates in the arteries. Can you hand this to her in the back? Massive atheromas lurk within the vascular wall, outside the view of angiography, because what they're doing, they're shooting dye into the artery, and they're saying that most of the plaque is in the outer walls, and you'll see that. Massive atheromas lurking within the vascular wall, not in the lumen. Now the lumen is where the blood actually flows. So this is the wall here, if you look at a cross section of the artery, and the lumen is the inside. And what they look for when they shoot dye in, they look for some plaque like that they can actually bypass. And what this gentleman is saying is that most of the plaque is in the walls of the artery, not in the lumen. Okay? And these particular lesions account for 2/3 of heart attacks and hemodynamically insignificant stenosis. Wow, what does that mean? To be stenosed means to be tight. Osis means too much tightness. Insignificant means that they can't bypass it and make that $130,000 real quick. Okay? Hemodynamically means blood flow. So it means that the blood appears to flow effortlessly, because it's hemodynamically insignificant stenosis or tightness. So what he says, this is a painful lesson for my colleagues in interventional cardiology. Interventional means do something, stick a catheter and open it up with a balloon, intervene. And this is a painful lesson. They don't like to be told they're looking at the wrong endpoint when they give patients with a normal angiogram a clean bill of health. Isn't that interesting? Excuse me?
Tim Russell.
Yeah, that's right. So to demonstrate, he showed apparently normal angiograms of a particular artery, and then they did a new type of test called intravascular ultrasound. Now, the intra part means it's within the vessel. Vascular, intravascular, in the vessel, ultrasound. So they send sound waves to check the thickness of the artery wall. And they were able to demonstrate in arteries that they shot dye in, they looked normal, but when you did the intra-arterial or intravascular ultrasound, it showed massive plaque all around the arteries. So that's what he did. And he also said the angiographic model of coronary artery disease, that's the model that they're still using in all the major institutions, is dead wrong. As soon as I saw this, I called some of my cardiology associates or acquaintances, let's say, and they said, oh yeah, we know about that test. It costs an extra $1,000 to do it. We don't do it. I said, oh, okay. So That's what they're saying. It's dead wrong. So these would explain why interventional cardiology procedures relieve angina. Now, intervention, again, they do something. They shoot dye in, see, visualize, let's say, what they would consider luminal plaque. So intraluminal plaque, that means in the lumen. And then they shoot a balloon in there, open it up, and maybe put a stent in. Okay, that's the angioplasty with the stent. Or more drastically, they take a saw and saw your chest apart and then split it. And then they hold it back with these metal rods, and they hook your heart up to a heart machine. That's about as big as half this room. And sometimes people mentally don't come out right after that. And it's and then they do all that, and then they bypass it, and then they sew you up. And guess what? It may relieve angina. Angina means pain. So this explains why interventional cardiology procedures relieve pain or angina, but do not reduce the risk of mortality or death from future heart attacks. So getting bypass surgery or angioplasty with stents do not decrease your chances of future death from future heart disease and heart attacks. You have to do something else, and that would be total body therapy, which is metabolic therapy. Weight loss, lowering your cholesterol by any means necessary. And there's different ways to do that, of course. There's some ways that are better than others. Some of the drugs aren't so good. But just for a point, that explains why lipid-lowering drugs reduce cardiovascular event rates, even though they do not dramatically improve coronary angiographic findings. In other words, you can lower the lipids with drugs or with diet, and you'll probably get some plaque reversal here, but it may not be enough to really see a lot, but yet you still have less death, better function. And that's because of collateral circulation, also small vessels. Because if you have plaque like that here, just think about the teeny tiny vessels at the ends of these larger vessels. Then you're going to have a lot of plaque, relative to the size of the vessel. And that's where systemic treatment, and of course that's what we offer at the American Clinics for Preventive Medicine. We offer systemic treatment and on a natural style, which is a lot better. And they also go on to say they challenge the 40 years of conventional wisdom that heart disease is primarily a plumbing problem. They used to think that to reduce morbidity and mortality by narrowing the lumen. In other words, by whitening the lumen, I should say, but that's not how you do it. Now, if you go to the next page, and this is a great article, as you see, just to go down to the second paragraph, he says, I'm going to show you that 95 to 99% of all coronary disease, what it really looks like. And then dropping down to the last sentence of the third paragraph, most atherosclerosis, again, osis means too much of, sclero means hard, athero means artery. Most hardening of the arteries forms in the external layers of the artery wall. So if you look for the disease, or you look at the disease with the exercise stress test, if you look for it with an angiogram and they shoot dye in you, which both tests are really dangerous. When people come to the American Clinics for Preventive Medicine under our care, and I see someone who, let's say, all the risk factors, they have a family history, they smoke, they're obese, they have high blood pressure, not controlled, they have diabetes not well controlled, high cholesterol, high triglycerides. Most doctors will say, look, good, let's go and get you on the stress test to see if we can see something. You may die on the stress test. Well, you feel pain? Good. Keep going, let's see if it registers well. I don't do that. What I do, I use the stress test after we're done with the metabolic systemic treatment that we do at the American Clinics for Preventive Medicine, and we show off with it later. We don't do it because the only reason you're going to do stress tests, you get some positive finding, then you're going to do a cath, and then they're going to do a procedure. But that is not the total answer. Rarely, you know, you may benefit, like there's a widower's lesion. A widower's lesion is the left main stem is blocked, and that you probably want to bypass, because that's why they call it the widower's lesion. Okay? But otherwise, no. Okay? If you look at the disease with a stress test, if you look for it with the angiogram, you do not see the disease here, here, or here. And he was given a lecture, and he was pointing to ominous atheromas filling the external elastic membrane of an otherwise healthy 32-year-old patient whose heart was transplanted after her death in a car accident. In other words, they did a study on heart transplant donors. So somebody dies in an accident, and then they take out the heart to give to someone, and that's all good. But they studied them with this new method. They compared the angiogram shooting the dye in to these hearts that were just standing there, just sitting there. And then they did the new test, and that's what they did. For instance, the Titanic got to see 16% of the iceberg that destroyed it. As cardiologists with angiography, we only get to see 1% of the disease that kills half the population and 80% of all diabetics. That's not too good. You know, and meanwhile, they're putting another McDonald's in the hospital. That's suspect right there. The next paragraph, in autopsy evaluations of 262 heart transplant donors. So again, they looked at people who had died. Anybody see the movie John Q with Denzel Washington? Well, you can look at it and you can appreciate it. A lady was driving and she passed, and she was a heart donor because she wrecked. But anyway, hardening of the arteries was found by intravascular ultrasound. Now check this out. In 17% of donors younger than 20. Did you hear that? 17% of Americans under 20 years old have coronary artery disease. 17%. Is that something else? That's the third paragraph up. Yes, of course. And just a point in case, I know of a case of a 16-year-old male who was 185 pounds and had adult onset diabetes and high cholesterol. And he had a heart attack at 16. And remember the Vietnam veterans, and they did autopsies, and in their 20s they already had big plaque many times. Okay, and then 37% of us in our 20s have hardening of the arteries, 60% in the 30s, 71% in the 40s, and 85% of Americans in their 50s were found to have coronary artery disease by the intravascular ultrasound method. That's a lot, and it escalates. So, you know, so basically, this is a great finding. If you go to the third page, the two things that were most predictive of whether you had this particular type of plaque in the outer arteries was body mass index, and that's obesity level, and smoking. Anybody in this room smoke? Okay. Smoking is a particular lethal thing. It's not even cool anymore, right? So the way to stop smoking is to not smoke in your house, your car, or first thing in the morning. And to make it in your most undesirable activity list. When you wake up in the morning, put on your favorite dancing DVD or CD and dance, eat, wash up, and then go out and smoke. And don't let any children see you smoke, because as handsome as you are, you may influence them the wrong way. Okay. So house, car, first thing in the morning. That's how you do that. When you see patients at middle age with type 2 diabetes, they very likely have extensive atherosclerotic disease, regardless of the ancillary testing that they may do, like stress tests or angiographies. So basically, this is very interesting news. You can, the last sentence is stabilization of unstable atheromas is an attainable goal. And we see that in our testimonials alone. I'm going to pass some of these around, and here, and you can a couple.
Advanced version too.
Right.
Additional ones.
Right. So, yeah, pass those around. Yeah, and yeah, and you can them. And here's some for the back. Go ahead and pass it.
You can keep the black and white.
Yeah, keep the black and whites. Return those. Okay, so you see, this is a big systemic problem. This can be reversed now without drugs. I want to say that. The reversal process that we use here is without drugs, and that has to do with our up-and-coming book, my manual, and it will be a major book, Reversing Heart and Artery Disease. And of course, it's naturally done. So this is an overview of this particular method. And this idea started really when I was holding the aorta, which is the major artery coming from the heart. And I was holding some guy's aorta at 3:30 in the morning, and it had busted. And I was so tired. And the surgeon said, "Richardson, stay awake." I mean, you know, can you imagine? I'm holding some guy's major artery, and I'm like dead tired, man. That's the medical. And so the nurses had to come and keep patting me and all around and make me feel important, you know. I'm holding this guy. Wow. And then when the surgeon bypassed it so he could replace it, I looked inside, and my God, it looked like gristle and fatty deposits and grease. I said, my goodness. So then I went to the library and got all these books. I said, what causes that? That is very, very deep. So I went and studied it, and I had a beautiful redhead resident, because I was just an intern. And she said, I'm impressed. So that was positive feedback. So I studied, and kept studying, and it led me to the research that I did at University of Alabama in Birmingham, in the preventive medicine department. And what I discovered was that not only is hypertension, high cholesterol, but heart disease itself is reversible and treatable naturally. So we've established that it's an epidemic, right? And we've gone over some statistics. Now, we can also talk about who's really profiting from this. I mentioned that disease reversal treatment here at ACPM, it may cost a certain amount of money, say $4,000, okay? Compared to $130,000 open heart surgery, compared to a $60,000 angiogram, and it doesn't even do the job. That's pretty bad. So they got you coming and going. They got the McDonald's and the Chick-fil-A there at the hospital waiting on you so you can order a double-decker Big Mac right after your open heart surgery. So I would say that their intentions are not all pure. Let's just put it that way. And therefore, the people making a lot of money from this include certain big business, cigarette companies certainly, the meat industry, the dairy industry, the fast food chains, and those types of things. Then on the other end, who do you think is making greater profits? The hospitals, the doctors, and I should say the surgeons, or the drug companies?
Drug companies.
The drug companies. And, you know, I'm not an economics major at all, so it's hard for me to even conceive of this. But then I kind of got the idea when I was an intern, and they sent a real nicely dressed drug reps to convince me, as a new doctor, intern, to give and write and prescribe, was it Benedictine to pregnant females, because it was supposed to stop the nausea and everything. And then 6 months later, after those nicely dressed people came, there was a bulletin and it said, "Oh, stop giving that drug because it causes birth defects." I said, well, it'll be a cold day, and you know what, before I listen to some drug reps, I just laugh at them. Yeah, what do you have now? Yeah, okay, right, because that was a night, that burn isn't going to happen again. And then, of course, they get you in the hospitals, and and I think we built a major industry. It's almost unstoppable, because if I'm able to demonstrate, which I've demonstrated, you can see in the testimonials, of disease reversal for a few $1,000s versus $130,000 plus dollars. One man had not one, not two, but 3 open heart surgeries, was on 7 drugs, couldn't walk from here to the end of that, to where the door is on the street without getting the chest discomfort, like Red Fox, who he did Sanford and Son. Now, they say I look like, who do I look like in Sanford and Son? Yep, that's what everybody says. And Grady was handsome. He was a nice guy, so I am not ashamed. Yeah, but in Red Fox, he did reach his demise by a heart attack, and my father as well, you know, and he was even a physician, so he didn't get it, but he was a great physician. But I am taking it on another style, another more natural wave. So what we're going to do is go over the particulars in this particular class. This is just the introduction. I want to make sure that I cover everything. Like I said, the basis of preventing and reversing heart disease, of course, medical management. Now, I've known some people to come to my clinic and they really want nothing to do with the medical profession to a fault. And they probably needed to take temporarily some anti-pain drugs, and that they should have done, let's say, because they didn't make it to their first chelation therapy. So, you know, you have to know when to say when. But really, everyone gets off of the drugs. And I work in, I won't mention the hospital, but I work in the North Georgia mountains. Beautiful area, beautiful hospital. You should see the people who have coronary artery disease, person after person after person. And diet is a very important factor, and the diet should be a 10 or 15% fat diet. Dean Ornish has proven you can reverse heart disease dietarily. Exercise is a mess, but you may start slow. You may not want to do a stress test level exercise right away. You have to earn that right, so to speak. I have a patient I was exercising in the park with because I do kickboxing, and I was teaching him that, and he's about, I guess he's about 150 pounds overweight, and he's already lost about 100 pounds. And he has had a clean diet for some time and everything, so we were able to get his heart rate up. But if he was on an unclean diet and some other problems, he could have had a heart attack. See, so you have to earn that right. Stress reduction, excuse me. Dean Ornish has put out a book about having a good spiritual family life and all that sort of thing. That's important. Don't argue with your wife. It could be your last words. And herbs and nutritional supplements, we have some mastery over that. The herbs can pull the cholesterol out of the body and help. Just about everyone, 90%, 99% of people who come through, they may have cholesterols of 296. We get them down to 146. We've had people with cholesterols of 360, 410, and we get them down to normal with the disease reversal methods. And we school people how to do it. We put the supplements in there to help allay some of the symptoms and pull it down. We have excellent supplements for hypertension too that we found, some Chinese ones. Smoking and alcohol and caffeine cessation. Smoking cessation is a must, just make up your mind. And intravenous EDTA chelation therapy is a must for heart disease because what it does is reverse hardening of the arteries by pulling out the lead and cadmium out of the matrix of the plaque, and it thereby helps the plaque resorb into the body. It also opens up, it's been demonstrated to open up the vessels. And all you need is a little bit of opening for the blood flow to increase exponentially well. Because you have 60,000 miles of blood vessels in the body. So if you just open all of them up, that blood flow is going to flow like a pulse, much, much better. When you add chelation therapy to dietary manipulation to the herbs, you have a synergistic effect of almost, from my eyes, pretty close to 100% cure rate for heart disease. And that's bold to even be able to say. So that's with that chelation therapy and all the other methods that we do. All right, let's see now. Some of the problems with surgery you have to understand. You can have botched blood transfusions, have dysfunction of machinery. You can develop psychological or mental dysfunction and heart dysfunction. And sterilization results in faulty sterilization can result in 100,000 hospital infections, and that's not pretty. And about 20% of hospitalized patients check out with 20% check out with diseases that they developed within the hospital. You know, so so this is all true. So I just wanted to bring this to everyone's attention. So we are going to be giving these talks. I think that's a good amount of information you have that you can spread the word. This room hopefully will be filled. We'll be sending out information when we have these type of talks, and you're welcome. It's our giving back to the public, and we just have a earnest to do that. Now I'm going to open this up to questions at this time. Yes?
If you don't do the stress test, what do you use to measure how bad your heart disease or plaque is?
Right. Well, actually use mostly functional aspects. For instance, if someone comes in, I can look at their eyes and be able to tell usually how much plaque they have. Either looking behind in the back of their eyeballs at the retina, because you can see the blood vessels, and also externally in the iris. So knowing the statistics, if someone comes in my office and they're 55 years old, they have an 85% chance right there of having significant plaque. Then if you add that high cholesterol, high blood pressure, obesity, diabetes, any of those, then it just goes up. So basically, yeah, and if I see rings in the eye, certain rings in the eye, if I also see back in the vessels plaque evidence, then that's my evidence there that I treated aggressively to prevent future woes. Because where do you think Alzheimer's comes from? It comes from partly plaque impeding the function of the brain cells, and then they become degenerate, and then they accumulate the amalgam. No, not the amalgam, amygdaloid, sorry, in the cells. And then they collect the heavy metals. With chelation, you pull the heavy metals out. The newest drugs for Alzheimer's are going to involve things that dissolve the plaque within the cells, and they bust out the heavy metals, and then chelation will pull that off. That's going to be really hot treatment. So, and it really depends on the age of the person, the diet, the other health problems, whether I make a judgment that they could benefit from cardiovascular disease reversal. Yes?
What is chelation?
Chele, C-H-E-L-E, is a Greek name that means claw of a crab or lobster. So, chelation therapy is using a man-made amino acid, in this case EDTA, which stands for ethylene diamine tetraacetic acid. Okay? And you know, if you want to learn to say that, say supercalifragilisticexpialidocious, as I always say. You know. But anyway, what it does, you inject it in the body in an IV over 3 hours, along with magnesium, vitamin C, B vitamins, and other various constituents. And what it does, it lets the magnesium go, pushes the magnesium in the cell, and pulls calcium out of the cells, of the cells that surround the blood vessels. And it actually shoots calcium in the bone. So it pulls it out where it's not supposed to be, the joints and the arteries. And not only calcium that shouldn't belong there, it also pulls out cadmium, aluminum, lead, and flushes it out. Whoops, flushes it out through the feces and the urine. And that's what chelation does.
One other question.
Certainly.
I'm not medically inclined here, but some of this stuff says angiogram
Right.
Some said angioplasty. What's the...
Well, angio means vessel. Gram means picture. So when they do an angiogram, they shoot dye in the vessel and then take a picture to see if they can see blockage. Okay? Angioplasty means that, oh, we see blockage, then they're going to send in a balloon and they'll inflate the balloon and push the plaque to the side. That's angioplasty.
So angiogram is just a diagnosis.
It's right. And angioplasty is a treatment, and then they can put a stent in there to hold it back. And now they can put even a medicated stent. And what, yeah, they have medicine there that does something. Yes, a medicated stent. And what I'm saying, yeah.
You're saying that this plaque that's in the artery wall can be removed?
It can be removed, but not by angioplasty or stent, because that's only to remove the one that's in the lumen. The lumen is the opening or where the blood flows within the blood vessel. That other plaque has to be removed by systemic treatments, which treat the whole body.
So you can't get it out?
Yes, that's what the last statement says on the article. The last statement says, stabilization of unstable atheromas is an attainable goal. And then the natural history experiment showed that extraluminal plaques regress by as much as 2 millimeters, which is a lot when you're dealing with vessels, when atherosclerotic heart donors were transplanted into recipients without atherosclerotic disease. How many people actually understand that? Okay, you do? Okay, one person. In other words, they took diseased hearts and put them in people, let's say maybe they had a valvular heart disease, but they didn't have coronary artery disease, and they just had a bad valve. And they replaced it in those people, and the heart, the blocked, the thickening or atheromas or all that plaque disappeared when they put it in someone who wasn't prone to that type of heart disease. They had another more structural problem, like a congenital heart disease that they were born with, and the valve was messed up. And they were waiting all these years for a heart transplant. And then here somebody's a smoker, they have high cholesterol, and their arteries are diseased. And they put that heart in the person who only had a heart defect because of a malformation.
Everything went okay.
And then the disease in the heart actually reversed because their bodies were cleaner. They weren't smoking, they didn't have high cholesterol and all that. So it reversed. Now, if you take a smoker and someone with high cholesterol, why not reverse it within their body, and then they can reverse their own artery disease? And that's what we do with the disease reversal program that we offer, as well as the chelation therapy. And when you add them both together, you get a almost 100% cure rate of heart disease that I've seen, that I've observed in my practice.
They don't think outside. They're still, like you say, doing this shoot you with the dye and all that.
Yeah, they look at it differently, but they are good at putting new McDonald's in their hospitals. They're really good at that, because that's the bottom line, money. And then it's a revolving door. I was thinking about opening up a drug rehab and then putting a bar next door. When you get out the drug rehab, you get a free ticket to the bar, and then we'll have a pile of, 3 free drinks when you get out the drug rehab. But basically, that's what they're doing. It's pretty pitiful, don't you think? They don't have the guts to stand up and really look at the data appropriately. My question is everybody doing their job? Me and my brother were discussing that. And of course, nobody's perfect, but that's how it is.